Good afternoon, folks. Great to see you all, and welcome to the new semester and new CTSI Workforce Development Workshop series on community engagement. This is a new series, so significantly revamped since the last time it's been taught, and we're very grateful to the faculty lead, Dr. Laurene Tumiel-Berhalter from the Department of Family Medicine, who is running this workshop this year with the help of our staff, Elizabeth Bengard and Catherine Sidota. Before we pass the microphone to Laurene, I wanted to highlight for those of you who are new to CTSI Workforce Development that we offer a whole portfolio of various training opportunities for the folks free of charge. In a very convenient and flexible format, just like this workshop. And you can find the schedule on the CTSI Workforce Development website that we update. You can also find the previously taught workshops that are recorded, and most of them are available if you would like to review the material or decide if you want to see them in person or in a synchronous format the subsequent year. For many of the workshops, right here, so the idea of the workshops, this is not a replacement for full tuition-bearing courses. This is an enhancement to either provide hands-on skills, such as scientific communication, community engagement, understanding of core translational competencies such as effective teaching or biostatistical methods. And those courses can be used to, these workshops could be supplement existing courses or could be used in an introduction. So if you complete the course workshop and you said, well, this is really a topic I want to know more about, the faculty in that workshop would give you good recommendations of what courses you may want to take next. For those folks who can't commit to full-blown courses, we also offer digital badges. And there is a variety of those digital badges. There would be one coming on community engagement. And if you're interested in that badge, please contact Catherine. And there are several other badges that's available that is a hybrid of independent work and reviewed assignments that allow you to practice specific skills that are highlighted in those workshops. So we are trying to tailor our teaching and offering to your skills. And for those of you who are interested in CME credits, those are available for most of the workshops. So if you have any questions, you can text me in the chat or reach out. Dr. David Jacobs from the School of Pharmacy is Associate Director of Workforce Development, and he could be used as a resource also on a lot of information you'll be hearing today. So thank you very much for your attendance. Please fill in the evaluations forms. We like to hear from you, how you're learning and what you'd like to know more. And the microphone goes to Dr. Tumiel-Berhalter. Thank you very much, Laurene.
Oh, thank you so much. I'm really excited to do this this presentation in this series. I think it's really exciting for me from someone who has done community engaged research and to really think about how community engagement principles can be applied to anything academic that we do. And so hopefully these are some pretty applicable skills that again, we're happy to talk more about or to work with our community engagement core of the Clinical and Translational Science Institute to help kind of get a roadmap for how to do this.
Yes. Before I forget, Laurene, so I want to mention one other novel approach that we're trying this year, and we are trying to make sure that when we define community engagement, we're not only talking about CTSI of things doing people doing translational research. Community engagement is a generalizable principle that could speed up implementation and dissemination of all research innovation, whether it's in engineering, social work. So if you hear examples in this workshop that's referring to clinical practice, don't assume that it could only be used in clinical practice. Most of his principles are generalizable to working with different stakeholders populations, whether they're from industry, manufacturing, IT, government, policy, and feel free to bring your own examples to stimulate discussions today and for the subsequent weeks. So we're really looking for diversity of applications and participation. Thank you very much.
Great, thanks. So again, this first session is really about an introduction to community engagement. And one of the things that I've learned over the years is that sometimes we think, oh, community engagement, how hard can that be? You just go out and you just talk to people. And really, in an academic setting, regardless of whether it's teaching or policy or research, we have to think about the messages that we're sending and who we're representing and who we're talking to. And so it really does require a lot more thought and carefulness about how we engage different partners. So I'm hoping to bring some of that into light as we walk through this introduction. So to start, and there's a link in the chat or the QR code, wondering if you could give one word of how you would describe your community. Great. Togetherness, friendly, safe, diverse, inclusive, support, walkable, hopeful, neighborly, under attack, connected, supportive. This is great. You know, I just did this a very similar exercise with a community group, and hopeful, trusted, and we had some of the same words, and we had other words like stressed and loved and support. So it's interesting that no matter what population or what group you're talking to about neighborhood, we all value the same things in our communities. And so that's a really important thing to walk away with. All right, great. So I'm going to share my screen again. So remember, in our academic setting, all of the work that we do, whether it's research, education, development, it's going to impact a person or a group of people, and is always going to be influenced by outside factors. And what those outside factors are, you can never predict all of them and what they're going to be. It could be, the political lens that we're experiencing now. It could be a local crisis of some sort. You never know. So we really have to think about how the context in which people are responding to us in, because that really can influence how a person is impacted. So when we think about a community, especially if we're looking at the application of community engagement in any of the work we do, we really have to think about who is going to be impacted by your work. And which is a little bit of a different lens than when we think about our own personal communities. We're really thinking about the community of influence. So that could be a geography if we're working in a certain community. It could be a certain group with a common interest, like marathon runners. There's some commonality there and some synergy in people who run marathons. Whether we're working with a community group, a religious group, a virtual group. Gaming is a huge community now. And when we think about all the social media output that we have, we're reaching people in a different way, in a different type of person, in a different context. It could be an occupational group, or again, sports fans. We still love our Bills even after very sad loss, right? But I've gone all over the country and have found Bills bars everywhere. And I'm sure many of you have experienced that too. So it's local, but it's really not, and can take on many different lenses. So again, when we think about defining our communities, a lot of times in research, it's eligibility criteria, right? Who do we want to participate in our research studies? But they can be intended communities. Who are we trying to reach in terms of education or policy development? Are there health disparities or health equity that we're trying to address or trying to impact by our work? The thing that's really important here is shared agendas. who is going to be impacted, but who also has a similar emphasis, a similar goal. So instead of just thinking about who, in addition to thinking about who's being impacted, it's who's also driving that mission. It's not just researchers, it's not just educators, it's just not policy directors. There are tons of businesses and community-based organizations and grassroots groups that may have a very similar mission to you. And so all of these groups with a shared agenda can influence things like research, education, development of any sort, can influence the integration of the way academia is into the community, and can also influence the reputation of academia in the community. As I mentioned, I had a group yesterday, a community group that I was working with. And the reality is academic institutions, including UB, do not always have a positive reputation in the community. They're large institutions and there's a lot of trust that needs to be developed and built. And so these are some of the ways that we could actually, by working with people with shared agendas, help to improve the reputation of our much larger institution. So how is community defined? And again, thinking a little bit more in detail, not only who is the intended community, and again, that could be geography or somebody's background, perhaps a health condition or shared experience, but who will your work impact? An individual or a patient, maybe a provider, maybe a system. It could be an educational system. It could be public, a private company. It could be a healthcare system. It could impact a lot of different things. Who is critical to the development of your work? So as academics, we often, we do our literature reviews and we do our background, but yet again, there's all these people with shared agendas that could actually help inform us outside of what we learn from the literature. People like the end user, industry, tech companies, business companies, or we need the skills that those industries bring to our work. Certainly, in terms of technology, my skills are so limited that if I was doing a certain project or trying to do education around something, maybe reaching out to one of those tech partners could really help enlighten me and bring some real world experience into whatever I'm trying to do. And also then thinking about, okay, we've done our work, we've done our background work, we're developing policy, we're, developing an educational curriculum. But who is critical to the implementation? Because once you're done doing the planning, again, with our academic lens on, how is that work sustained? How is that work integrated into the community? So again, thinking about, is it policy? Do we need government involved? Do we need payer systems involved to help move our work into policy? So community can take on many different forms and provide lots of different lenses that are different and unique than our own and can really help to move our work forward. So most of the time, these partners, these definitions of community are non-academic, right? So they could be in any sector, public, private, but they're not generally in the academic setting. They have lived experience or a complementary skill set. And we also need to think about intersectionality. We all don't belong to a single community. And thinking about how those communities or different groups of people work together is really important. And also think about hidden communities that often don't have a voice. Thinking about the homeless population, you could be doing housing development, but unless you're talking about with somebody, talking with someone who's struggling with housing could be super informative to whatever you're planning or whatever you're trying to develop. So community engagement, according to the CDC, is a process of working collaboratively with and through groups of people affiliated by geography, interest, similar situations. But this is an important part that I think we want to emphasize. It is a powerful vehicle for bringing about environmental and behavioral changes that will improve the health of the community.
Hey, Jennifer, I'm in
and its members
meeting today.
So thinking about change that's resulting beyond the academic product, beyond the curriculum, beyond the policy, beyond the research outcome? What change are we going to make in the community through these engaging opportunities? So community engagement is an approach to academic work. It is not meant to replace methods. It is not a discipline in and of itself, and it really can be applied to any outcome. So thinking about the breadth of community engagement and the work that you're doing and how community, as you define community, can help you to move your work forward and also be a win for the community. Really like thinking about how can that help move that shared agenda forward. So this is a community engagement continuum, which is taken from the second edition of the Principles of Community Engagement, and thinking about the increasing level of community. So community engagement does not have to look at the same. In fact, it will look very different for whatever purpose you're thinking about, whatever level of commitment you're willing to give to the engagement opportunity. And so really trying to plan for that. What are you willing to give? Because community engagement, we'll talk about this more later, takes some commitment. And you have to be fair and reasonable with yourself and your team about how much commitment you're going to give, and be able to be honest about that with your community partners as well. So thinking about doing general outreach, right? Just being part of the community and maybe doing some basic one-way education about whatever it is you're doing. It could be, again, a topical area, as part of the Clinical and Translational Science Institute, we talk a lot about science literacy and helping people to understand what research is, what their rights are, talk about mistrust in the community so that they feel like they can be part of either part of a project, a participant in a study, or potentially, a partner in something. Also doing consulting, something that's a little bit more deep. Outreach could be a few seconds, and I'm going to give you some more examples of this, but doing some consulting where you're actually engaging a group in a little more in depth, as opposed to involving. And you can see how the commitment and the level of involvement and engagement is increasing from involvement to collaboration, all the way to shared leadership. So really having a community partner that co-owns whatever the project is that you're working on. And I'm going to give you some examples of each of these. So with outreach, this is a great opportunity. Sometimes I get the sense that people think outreach, okay, you go in the community, you set up a table, but really to do good outreach, you need to be really thoughtful about what community are you in? Who are you going to be talking to? Kids, families, adults, seniors. It's also a great way to network with other organizations, because if there's at a tabling event or a health fair or a job fair or something like that you're part of, there's a lot of other organizations there that you can meet and talk to. And again, think about those shared agendas. It allows for conversation with people, just people who are just there to check things out. It's a mode of disseminating your work and communicating your work. And we'll be talking about this. This is a plug for our next session, using plain language and knowing that scientists and educators do not speak in the same way that we do when we're in our general communities and with our family and friends who are not from that environment. It also helps to build trust. I can't tell you how many times I've been in the community and I hear, well, it's about time UB's out here. Who knows what's going on behind those closed doors. I hear that all the time, really wanting to talk about what is it? One of my roles is to enhance participation in research. Well, the reality of it is that the potential studies don't get to various communities. So thinking about how we can reach out and build those relationships and share more about what we're doing in a transparent manner. And it really helps us to develop relationships. Being out, and just being in a comfortable setting and having some conversations really helps us go a long way. When we do outreach, and I think this is really important, you can see in some of the photos, little spinning wheel. We really like to be thoughtful about what we're talking to people about. Again, using understandable examples of, of the work that we're doing, having giveaways. A table of paper is no fun. You really want to give somebody something to talk about. So that spinning wheel, I've had it for 20 years and people love it because it clicks and you put some fun questions on there. I work with a group that does wastewater analysis, and I'll tell you, little kids love to talk about poop and what we can learn from poop. And it's fun. And we got all like emoji, the little poop emoji stickers and bendable figures, because it's fun. It brings people to the table. It starts a conversation that you might not be able to have otherwise. One of the other things on this table here is you can see little test tubes. Those little ones there doing they're water strips to test the pollutants in some samples of water. Many people, adults, when we do this, want to take it home and the strips home and test their own water. Dr. Surtees does cheek swabs where she makes necklaces of DNA. So people really learn about the DNA extraction process and they're part of it, hands-on, kind of learning about things. So really trying to give people a conversation starter where they're having fun, because you might only interact with these individuals for 30 seconds to a minute. And just trying to think about ways to do that in an engaging way and low pressure way. So the consults, again, are a little bit more in depth and thinking about, okay, what community am I thinking about? Someone with a shared agenda, an end user? Who is someone that might benefit from the work that I'm doing? And you might have a question about your work, like what are important things in a curriculum to talk about, or what are important research outcomes to the community? Whatever the case may be, but you can get a group of people together one time only. Always helps to have food, which I know is a challenge when things are grant funded. And we can talk about some strategies for that. And pay them a gift card. Volunteers' time are just as important and as valuable as ours. This is what we do for a living. And sometimes community-based organizations are like, okay, I'm fine. That's great. I can do this as part of my job if there's a shared agenda there. But if it's not, a gift card is really welcomed and appreciated. So community, again, it could be a payer, it could be industry, can help with the design or planning of something you're working on, but they can also be helpful with how to implement a process or disseminate the results of your work in a way that's not a traditional academic output. These are community experts who know more about their lived experience than anyone. I did a lot of work on around asthma for a while. I don't have asthma. I don't know what it's like to live with asthma or dealing with the healthcare system around asthma. A community person that has that lived experience can really inform a lot about things that I would never have thought about. So again, we have tools to help people do this as part of our community engagement core. We do hold community engagement studios where we help plan those one-time only consult sessions. And for the most part, they've been targeted on research projects and aspects of a research project, but they've also been targeted and intended for, okay, I want to develop this intervention. So this intervention, it could be, again, an educational curriculum. It could be a policy. So this model can be used for many different outcomes, not just research. But the idea of helping our faculty think about what community would be best to give them the feedback that they're interested in, and how do we recruit those individuals to help us. And we'll be talking a lot about that over the next couple sessions through this series. So one way to involve community is to have a community advisory board. I'm sure many of you are familiar with community advisory boards, or maybe even have been required to have one through different funding sources. Even some of the educational grants that we've received have required back or a community advisory board to help guide the work that's being done. And this takes those consults to a next stage, because it means that people are meeting more regularly. You're meeting with the same group of people. A lot of times it could range anywhere between a month to, say, quarterly. I think quarterly is pretty standard for any type of board or a community board. So you're starting to develop this ongoing relationship where the community advisory board receives updates on the project and provides feedback at various touch points, but they're integrated in a very structured way, right? So it's kind of blending these two worlds, but they're not part of that day to day. So there are some great examples of community advisory boards. One I can share that I've been involved in is with Dr. Kaler, with Dr. Lise Kaler, who has a great board. Community board. She's a transplant surgeon and she does research as well. And this community advisory board helps with communication in a clinical perspective, but also from a research perspective. And it's made up of people who have received transplants, those who are caregivers, dialysis social workers. So lots of different people who touch that process in different ways. And they all meet together monthly and give some incredible feedback to help move that work along. Another example that's a little bit different is I have a colleague in family medicine who does work with adolescents, and her community advisory board is teenagers, and bringing teenagers to the table to talk about. Her project is around food and eating healthy, and really helping to understand what a teenager thinks about or doesn't think about when it comes to healthy eating, and kind of learning those good habits. And she's partnering with the school to help develop those relationships. So it's not taking students out into an environment that they're not comfortable with, but it's going to the school to help develop that relationship and have the students interact in a very trusted, safe environment. So thinking about how to do that. So some of these are on community advisory boards can be done by Zoom. I think that's happening a lot post-COVID, but it also helps us to engage people in different ways that we might not have been able to engage before. But there is still something about in-person dynamics. So having that as an option, even if it's an annual event, is always a nice thing to do. So then when we collaborate, it might be the investigator's idea, the educator's idea, the policymaker's idea. So we're not into a shared leadership yet, but there's an idea, there's someone with a shared agenda, and we want to go and talk to that group and help them, actually have them roll up their sleeves and work with us for a predetermined set of time. Like, so maybe for a couple months, we're rolling up our sleeves and we're going to work through this and we're going to develop something. So this is just an example of mine that, we met, oh my gosh, at least once a week for maybe 6 months, where we had to develop a campaign around cancer and, informing the community about risk factors and services. And one of our main partners was with the health department. So on one lens, I was working with the health department as a community partner and working with them to disseminate some information, but then also working with people in a geographic community to think about the content and what the community would really want to hear about. So you don't just have to have one partner. You might have partners that influence various aspects that engage with you at certain time points because of the need that you're at. This project is a really good example too, because we had some cancer educators from some health services organizations that we invited to come and give some educational sessions on for the people who were working with us on this campaign. And they actually wanted to stay and be part of it and to help, be there at the table if questions came up and offer some advice and their experience from when they've given educational opportunities along the way. So community engagement is not linear. It's not, sometimes it kind of is serendipitous, and you have people that just sort of, once you get started, say, oh, I heard you're doing this and I'd really like to hear more about it. So having that dynamic is really exciting. And so having people being able to collaborate with you, and even if it's for a specific aspect, there are people and organizations that are willing to really roll up their sleeves and help to move something forward, again, that fits their agenda. And lastly is shared leadership. And shared leadership is tough. It takes some time and lots of iterations, but this is when you're engaging the community throughout the whole process of what you're doing. And again, this is not a linear process because we're learning as we go, and we're learning with each other about all of this and what a project might look like, and thinking about, I guess where someone comes in and, being like, oh, I have this grant. And again, the more relationship you have, the easier it is to do this. When you have an existing partner and you can go and say, oh, I'm writing a grant on, or I have to create a service learning opportunity for a student. What do you think I should think about? Like, do you think what topic would work? Like, let's start there. Where should we go with this? And really just, or have a community member come to you and say, you know what? I am so sick of hearing about people having bad experiences in nursing homes. I'd really like to learn more about that, about what's going on. What is the university doing about this? What is UBMD doing about this? How can we learn more about it? Is there a project that we can do where we can work together? So that is the kind of end game that we would really love, is having the community partner help to inform what our research is, what our policy like things that we really have to think about in terms of policy, bringing that to the table. So us as an institution having an open door to engage people. But this is when you have people as members of your team that if you have a weekly team meeting, your community partner is there. They're written into the grants. They are co-authors on your curriculum, on your presentations, your publications. They're traveling with you to present your work, right? So they are part of this whole process, and it is truly a shared leadership. And we all know we have rules to follow, right? So we have rules, with grants and UB infrastructure that we have to follow. And it's all about compromise, and it's all about talking about what flexibility we have and what we don't, and what we don't have flexibility with. Why don't we have flexibility, and talking those things through. So, and the same thing that we need to learn about our community partners and what rules they have to follow. That's life. We have rules we have to follow and that we can't break. And we have checks and balances in place that we have to adhere to. And so do our partners. So let's talk that out and see where we can come up with a plan. So I feel like there's some really good examples of shared leadership. The photos here are a bunch of my colleagues from the Patient Voices Network, who are grassroots partners. We have a lot of people who are working with community health workers, and their mantra is truly having community health workers co-develop materials, research, and it's really about co-development and co-producing. And so thinking about our community partners, who also have a right to say, you know what, I'm not doing that because that does not fit with the mode we work in. So those are just two examples of some really great groups that do have shared leadership with different academics in our setting. So our community is really core. And, you know, when we think about this, and these are some models that I took here in terms of translational research. This is from the National Center for Advancing Translational Science, where patient involvement is at the core of the translational research process. The same with policy. So this is from the CDC. This is their policy framework. And again, stakeholder engagement and education is in the center of that. In terms of education, we have service learning, and we have a lot of bidirectional education with academic service to the community, civic engagement. So community engagement is core to our goals and our what we strive for as academics and as faculty at UB. So it's really a fundamental source that truly I don't think any of us are taught in our training. I certainly wasn't. I was sort of an on-the-job learner of this, and we don't get a lot of really structured guidance in terms of how to engage community with the different roles that we have and the different deliverables that we produce. So lots of challenges, right? Why doesn't everybody do community engagement? Because it's hard. And there are challenges. Again, academics are not trained to engage community. This is not something that is just embedded into our culture. Oftentimes our training opposes community engagement. We're on promotion and tenure deadlines. We have deadlines that are truly community deadlines, are not always in alignment with academic deadlines. We have semesters that we have to fit things into. And we know that community engagement, especially true, genuine community engagement, takes a lot of time. And it sends us back to the drawing board where we move forward and then we have new iterations of things that we need to consider. As I mentioned, there's a lot of institutional bureaucracy that we need to work through. It's challenging, again, depending on the level of your partner or the group that you want to engage. There's different rules that apply depending on what their systems look like. And there's also power imbalances. You know, if I'm doing work in the community and I have my Dr. Tumiel-Berhalter hat on, that shifts a power imbalance greater than if I just go in and say, hey, I'm Laurene and I'm from family medicine. There's still a power imbalance, but we're trying to reduce it as much as we can. And those power imbalances take time to like work through, make sure that somebody has a voice. You know, we are trained to be experts in our field, but again, truly our community partners have lived experience that we do not have. And so making sure that their voice is heard and is as valuable as ours are is really important. So setting that stage and making sure that we adhere to those, that foundational piece. Again, I mentioned earlier, plain language is really hard. It takes a lot of practice to write in plain language. Often when we do write in plain language, it takes several iterations, right? And it takes different people looking at it. And it really helps to engage somebody from the community to look at it and see if we are truly speaking to whoever our audience is. And every time I think I've done a really good job writing in plain language, I might set it aside and 3 weeks later look at it and go, oh my gosh, that's like atrocious that I use that sentence structure, or I use those words, and I used just jargon that I shouldn't have used. So it's really hard and it takes time to do. But why is it important? And I guess this is, it's just such a passion of mine to engage community and to work in community, and thinking about what over my years here in academia, thinking about the lived experience that really bridged real world with my world was incredible and was really a game changer. What was fascinating is I always tell a story about when the light bulb went off for me about community engagement and how important it is. And so I'll tell you the story. I was 23 years old and I was a research associate on a project in family medicine. And we were working in the lower, I was working with Dr. Carlos Hein, who some of you may remember, but he is currently the chair of family medicine in San Antonio. And we were working on this project together in the Lower West Side of Buffalo. And I was his research associate. And we were doing, we had a community advisory board. Again, I didn't know what we didn't use the terms community engagement at the time, but he had developed a community, invited people to be part of a community advisory board. I was just learning the ropes. I was early in my master's program. I was doing the data management pieces of it. So I was running the analysis and coming to these meetings and printing the analysis or presenting the analysis. So one of the surveys tools we use was the CAGE questionnaire, which assesses potential for possible dependence on alcohol. And I read the literature and I did the analysis and I went and I presented the analysis, and it showed that there was really not risk of dependency in the community. And the people at the table who lived and or worked in the community was like, that is not what we see in our community at all. And so they were talking and starting to think about what some of the issues might have been. And they said, wait a minute, where are the non-drinkers? And this was back when, now this is, 30 years ago. This was on the Lower West Side when it was mostly a Puerto Rican community, which it's changed dramatically since then, but that was kind of the context. And they said, where are the non-drinkers? And I said, well, they're in the low risk. You're not at risk group. And they said, that's your problem. That's your problem because in our community, we have a lot of people who are very religious, who don't drink. That's not. So the issue is among people who drink, we're going to see these differentials. And so I went back and I reran the analysis, and sure enough, we saw this different pattern here. Took it back to the community advisory board and they said, that is what we see in our community. So I thought this was just my eye opener, right? So just this past November, I was at a conference and Dr. Hein was at the conference, and we were talking with some people from San Antonio, some students that he had brought with him. And he told them the same exact story of the eye opener. So my example of the aha moment was his as well. After 30 years, I didn't even realize that was the case until we had this ad hoc conversation with a student at a conference. So it's one of those things that when you see that you could be misrepresenting the community with the data that you're presenting because of those aha moments, that was just mind-blowing to me. And realizing that we could read all the literature in the world, but if we don't understand the context, we might be making mistakes. Working with community partners at all different levels lead to new questions, lead to new ideas. It also can increase the sustainability of interventions and programs. Thinking about if we have a grant that's ending, whether it's an educational grant or a research grant, if it's ending and it's going away, if we're working with someone in the community that has a shared agenda, there might be a way to keep those programs alive based on what that agency or organization does. We address health disparities in a way and strive for health equity in a way that's different once we understand more context. It increases recruitment and research, the trust, the willing to have these transparent conversations, and it truly helps us to keep it real. So in community engagement, we treat the community partner the same as any academic partner. We're used to working with different academics as teams. So our community partner is no different than the academic partner in terms of the power or the influence or the shape of what we're doing. We recognize community nuances. We learn about the strengths and resources within the community and help to leverage those. We involve the community in a collaborative, equitable partnership. That does not mean equal, and I want to strive with that. And I can give you an example of this early on that was a potential huge error. I was working with a small practice, and we had a grant from NIH, and we thought it'd be great to split the budget right down the middle. And they would get 50%, we would get 50%. And this was all done with the best intentions. But with any grant, you know, the people come and go, the grant ends. And this was a small organization at the time. And so they were hiring people for the grant. They were in charge of some gift cards and things like that, as well as their own staff. Fast forward, end of the grant, there was a little thing called unemployment insurance, which I never knew about. I didn't even know there was such a thing. Because people came and went on that grant and people had to be laid off of the grant once the grant ended from their organization, it increased their unemployment insurance, but almost like 10 times higher than it was. And that it would stay at that rate for several years. So fiscally, because we wanted to be equal, we actually hurt them fiscally because it was a small practice and it impacted their and cash flow was a whole nother issue too. But I didn't know that. And thankfully, because I had a really good working relationship with this practice, we were able to work it out. And we said, okay, any grant we submit, the only thing that we want money for is to cover the cost of our staff who are already employed. You deal with all the new hires, you deal with all the gift cards, you deal with any of that because that impacted us in a negative way. So we learned, and now when we do grants together, we're much more thoughtful about those types of issues. We're always learning. That's one of the exciting things about engaging the community. You always learn something about systems, about culture, about whatever it is. And it for me, that's really exciting. I really love that part of engaging the community. And it's also exciting to build capacity. It's exciting for me to learn something new. And it's also like really exciting for me to see community partners come to the table who maybe don't have a skill, but then they build that skill as being part of the team. That is really exciting. And especially if you're doing some mentoring in there and bringing it, that's a really awesome part and something that's sustainable that you can leave behind in the community when you're developing potential job skills that could be applied in other ways too. Thinking about how to have a community outcome, whatever the action or policy that might be. And, thinking about the local relevance, and that I know from a research perspective, we always talk about how generalizable our work is, but with community engagement, there is a lens of local relevance that's really important. Again, it's iterative, it's cyclical, it requires compromise and discussion, but it also requires dissemination. That's something that I know has become much more visible to make sure that we disseminate our research outside in our educational efforts and, different programming more so than just in an academic way. And community can hold our feet to the fire to make sure we're doing that in a really positive way. And that could be through social media, local newspapers. From a research perspective, I like to do results parties and invite my participants back to hear about the results, which those are always fun. And we always do get a room of maybe 20 people that do come and want to hear about what we learned from the work that they contributed to. So community engagement is not research. And I feel like this is a really big, I see this happen all the time. If you're doing a focus group, it's not research. Like you're really engaging people. It's not part of the research project. Doing a focus group is research, but having a community partner plan that work is engagement. So there's nuances to it that are really important. But if somebody has to sign a consent form, it's not engagement. And it's not participation in a research project or in micro-credential. It's helping to plan that. It's being part of the group. And certainly it is not lip service. So if you want to engage a community partner in any way, shape, or form, from outreach up to shared partnership, if you don't want to hear the feedback and you're not going to see how you can integrate some of that feedback, don't bother. Don't waste your time. Don't waste your community, whatever your community partner is. Don't waste their time. So you really need to be committed to hearing. Sorry about that if you can hear my dog in the background. But you really have to be committed to not making every change or every suggestion, but being open to it and seeing which changes make sense. And again, I see this all the time. Your outreach, your consultation, and your advisory boards are not shared leadership. In the research world, we have a thing called CBPR. It's community-based participatory research, which is really about shared leadership. And I see that all the time where we're like, well, we're doing CBPR, but you had a consultation with a community partner. You're really not sharing the leadership. And those things are really important nuances. Again, community engagement is hard, especially if you are not of and from that community. You're asking people to trust you, and you have to build that trust, and you have to prove that you are trustworthy and deserving of that trust. Again, so in the conversation that I mentioned before, we were talking about, we have these investigators and researchers and educators that really like engaging the community. But in the scheme of Big UB, we are a very small number of faculty that like to do that and do it authentically and genuinely. And so I have spent 30 years seeing where community engagement doesn't work and cleaning up messes. And I don't like to do that. But mistakes happen. I've made plenty of them. But let's just acknowledge them. Let's learn from them. And, people are people, and they're pretty forgiving when you make a mistake, as long as you're acknowledging them and willing to work through them. Can't assume that you know everything about a community. And as particularly as researchers and educators, don't assume that people care about your work, because most of the time they don't. They care about their passion or their mission of their organization, and your work might align. And if it does, that makes for the strongest engagement, but we can't assume that people just want to support you. Take the time to know who to approach in your community. Depending on what community you're reaching out to, that's really, really, really important. And there's lots of missteps not knowing who to approach and being able to take the time and just learn how communities work. We cannot have unfair expectations of the community. We want to be straight. This is what we're asking for. This is what we hope your engagement will be like. And you don't have to have that all ironed out up front, but you could say, I don't know, let's work together and figure this out. Let's figure out a plan on how we want to work together and make tweaks along the way. So, right, just like any sort of relationship, you kind of have to start and stop and reset, and that's all okay, but be upfront what you're asking for. Are you asking for a letter of support? Are you asking for shared leadership? Are you asking for space to do recruitment? Be upfront and see how your potential community partner might respond to that. Learn about community norms and values and priorities. You don't want to want and not give. If you're going to do community engagement, plan on giving something back. Do not use research and academic jargon. Again, plug for plain language. And there's a term in the community called helicopter work, where you fly in, you take what you want, and you leave. And that is really frowned upon in many different communities that I've heard that term in, and that really just propagates mistrust of the university as a whole.
Lauren, we have a question in the chat. Do you mind if
Oh,
I
sure.
read it to you?
No, not at all. Go ahead.
Thank you. Can you elaborate more on the concept of shared leadership and specific criteria that it requires beyond decision making? Some examples would help. Thank you.
Sure. So again, like shared leadership, I'm trying to think. So in my experience, because that's the one I can speak to the most in depth with, I've worked with practices, I've worked with health departments, so community members of all levels, and a patient group. And certain organizations are more used to shared leadership, like, so let's take the Erie County Department of Health. We could work on a project together. They could say, I could call up Dr. Burstein and say, oh, I have this project and it seems like it's aligning with what you're doing. And we could have a conversation about fit very easily, where we're sharing that leadership. And I don't just make decisions without her. Maybe we look at different resources that she has or resources that I have, and how can they come together? Okay, so as I mentioned, that one example of the collaboration with our patients to develop that, our shared leadership was really with the health department. And like when we were trying to frame things like resources in the community, we were really working very closely with them to make sure that we were as neutral as possible in terms of identifying where people could go for screening. We did not want to come across in any way, shape, or form as favoring one service provider over another. Their team worked very closely, like with their communication team, with their legal team, really thinking about how to do that in the most appropriate way. And in the shared leadership, one of our funding was from the county, but they also wanted us to work with a marketing company that I had never done that before. And so that's something that I said, okay, well, we'll learn how to do that. And we worked together to kind of choose a firm and kind of work through that process. With the patient group I work with, it took a lot longer to have that shared leadership because of the power differential. It was an extreme power differential that we had to really think about how their practices were involved in our work. And it took a lot of storytelling on their end because, regular people don't talk in research question language the way we do. And so pulling from their stories and their experiences and the multiple experiences, and then saying like, oh, well, what do you think about this? And then they kind of help to refine data questions, look at survey, what are we asking people to do? Looking at recruitment materials and helping us make sure that those are appropriate for the community, that we're adhering to plain language, being co-investigators on grants, being at the table as we're doing the planning, being co-investigator or co-authors on papers. And it's different, right? They're not going to kind of put pen to paper, but they're going to read through the manuscript and say, you didn't highlight this enough. This is really important to us. Let's make sure that that's in there. I don't know if that's as important, but let's think about the framing. So those are some of the examples I could give you in terms of like shared leadership, where again, there's a person as part of that group is paid to be part of the research team, and to make some of those decisions. And with education, and every team is going to look a little bit different. So there's not like a cookie cutter way to do this, but it's really thinking about how to really, like, how would you engage your academic partners and do the same for your community partners? I hope that answered your question, and we could talk more if it didn't.
She gave you a thumbs up, so I think you're good.
Okay, good. So bad engagement I've seen happen, and it certainly perpetuates mistrust, and not only mistrust of the team is intimately involved, but it perpetuates mistrust of the institution. And there's again a lot of cleaning up about that. So it harms that institutional relationship with the. It also harms the relationship with other academics. So academics who really want to do community engagement have to work that much harder to build trust because of missteps of others. And, I think that is something that I've seen over time. And we've worked really hard to try not to let that happen. And if we could spot something that is a potential problem, I'll give you an example. There was a grant that was more of a workforce training grant that a community organization wanted to apply for and UB wanted to apply for. And again, think of the power differential here. And there was a lot of work that was happening in parallel, but then trying to bring people together, because only one of these grants was going to be funded in our region. And it was like, okay, we either have to get everybody on the same page here, or it could be a disaster. And there was a lot of me getting calls from the community partner complaining about this one investigator who wasn't listening, and me calling the investigator and saying, like, trying to be diplomatic about how to better engage with the community. And that was, I felt like I was put in a terrible position, and it worked out in a way. We were able to submit one grant, and the grant was obtained and funded. But one of the challenges was, after it was funded, there was a lot of like, well, you said you do this, but you didn't say you do this, because the UB section was really vaguely written. And so it took us quite a lot of time to get all on the same page. So those things happen. And, in that investigator sometimes, with that community group will just be like, no, we don't want to go back there. So trying to put out fires to make sure that we're adhering to all the principles of community engagement and being very authentic about it. And again, just as we wrap up here, I do feel like I love shared leadership and I'm committed to that work, but any community engagement in academia is good. People who are willing to go out in the community and just kind of get to know the people that you might be trying to recruit, or doing community presentations to talk about the studies that you're doing or disseminating your findings, that is all good. And again, it's not a linear process. In my world, I bounce between consults and shared leadership and outreach and all of those things all the time, depending on who the partner is, what the project is. But just being thoughtful about what I'm trying to do and how to best do it, so that, again, it's authentic and genuine, and I'm doing the best to be received favorably and building good relationships in our community. Here's a plug I mentioned earlier with the continuum of community engagement. That was in the second edition of the principles, and the third edition of the Principles of Community Engagement was released 2 weeks ago. So this was a work in progress for about 2.5, 3 years, and it is finally out there on the ATSDR CDC website. And so we're super excited about that. And in our future sessions, we'll be talking about the principles. And in the second edition, there were 9. In this edition, there is a 10th that was added, and that is being trustworthy. And so this one is all updated, and we're super excited that it's out. And so 5 o'clock, plenty of time for questions and discussion. I would love to hear your stories, your examples of work that you've done in communities that you've engaged with.
I just was wondering one thing, because you did mention that you might be talking about this later on. You mentioned, and everybody knows that food is a really important draw for people to come to different types of functions. So how do you get around the NIH not allowing food at specific events?
Yeah, this has been an ongoing problem. And at the national level, it's been on. So across the clinical and translational science, there's 63 of, we have the CTSI here in Buffalo. There's 63 across the country. Across the country, we have been having these conversations with senior leadership. You know, if we're going to talk the talk, we need to walk the walk. And breaking bread with a community partner is super important. And so the workarounds have been really finding other pots of money to do it and shifting funds around so that certain things are covered by NIH grants that maybe free up, you know, if there's a little residual account or an IFR account that you could use for food. That has been the major way that we've done it right now, because NIH still, there's still this tension around food. I was on a call a few months ago where the new director of NCATS was on the call and was asking about these things. And, you know, the chat was like blowing up with, we need to be able to get food. We need to be able to get food. Like if we really want to do this in an authentic way. So we have worked around it where, you know, I'm like, okay, I'll pay everything from this source and this is all legitimate funding, but I'll take food from another source. And then just try to find or there's some ways is if you do a sub-award with your community partner, they have more flexibility in buying food because it's not line item, you know, their sub-award is not line item to manage. They invoice for their money based on deliverables. And so it's not managed the same way as our like funding through sponsored projects. So that is a little bit of a workaround.
Great. And if somebody wants more information on that, can I give them your email to at least?
Absolutely.
Thank you so much.
Absolutely. And we work very closely with, you know, all of our administrators just to make sure that we're not, you know, we don't want to do anything that's going to be non-compliant or anything like that, but how can we do this in a way that's, you know, a legit workaround?
Right.
So I always do my checks and balances to make sure I'm not giving bad advice.
Great.
That's the last thing we want to do.
Questions or something you'd like to share, please do so. You can go ahead and mute or you can put it into the chat. Yeah, I'm going to stop sharing just so that if there's any questions, it's a little easier to see.
I have a question about the current funding at the NIH, the freeze. I know maybe I'm opening up a can of worm here, but what are your thoughts? Because a lot of our research here engage community, underserved, you know, type of research.
So, you know, I don't know what to think. I think we have a lot to learn about how they're actually going to be assessing, you know, DEI activities within these grants. You know, there's been a lot of conversations around it, and I guess the bee in my bonnet and the way I feel about it, which may not be, I don't know, but I feel like, right, our 3 pillars of research ethics are respect, beneficence, and justice. And in order to do just work, we have to reach all communities. And that means that we might have to reach them in different ways because there's cultural nuances, there's language, there's values and norms and all of those things. So the lens that I'm taking is I'm going to do the best work I can in the most just way and try to be across the board inclusive. I don't know how it's going to be viewed if you're like recruiting like special populations. Like that makes me a little bit nervous. But I wish we knew more about how that was going to be assessed. And is it just going to be a search term? But I'm just going to keep positive and keep plugging forward in the most ethical way that I know how to work for the good. And again, the good of the health for all. And, you know, with the CTSI, our our tagline is making research accessible for all. And I'm trying to block out some of the noise with the uncertainty and just trying to move forward in that light. I wish we had more specifics. And maybe I'm being naive.
Thank you.
So if you have a question, go ahead and ask. If not, if you would like to leave, please feel free to. And we thank you very much for coming to this. Lauren, you did a great job opening it up to all different areas, which is great. And we look forward to next week's with Andy Strommeyer and Grace McKenzie. And
Yep.
really very important. Lots of thank yous in the chat.
Thank you so much, everyone, for attending.